As a practicing physician, I wanted to create a place that folks could go to that not only delivers great health information in a way that's understandable and useful, but also share inspirational stories to help us all grow. People think that once you're adults, you're done learning. You are not. In order to be successful, you have to have an open mind to learn. Real problems discussed in depth with real solutions. This is the Dr. Nandi Show. Hello and welcome to the Dr. Nandi Show. As a practicing physician, I'm frequently asked by my patients, how can I get rid of my pain? Many people have seen multiple doctors, but no one seems to be able to provide relief. I'm talking about pain that's been around for weeks, months, and sometimes even years. It causes suffering, frustration, and stops folks from fully enjoying life. So today we're addressing the common cry for help for so many of my patients, and that is, please make my pain go away. Now, pain is very complex and varies from person to person. It can be caused by injuries, surgeries, or nerve damage. But sometimes you have no idea where the pain is coming from or even why it's happening. So, if you're like so many of my patients who've tried everything, this show is for you because I'm discussing exciting new techniques and methods to treat your pain. I've gathered top-notch experts who are not only excited to share their solutions, but many of them have also experienced chronic debilitating pain. So please don't go away. When we come back, we'll hear from my first guest, whose pain at one point was so overwhelming that it left her flat on the floor in tears, feeling out of options and out of willpower.
I couldn't sleep at night. I had to drink myself to sleep every single night for years. I just had physical pain. My mind never shut up. It was just non-stop negative chatter, and I would flip from anxiety to depression, back and forth.
Welcome back. You're watching the Dr. Nandi Show, and today's show is called Please Make My Pain Go Away, because that's exactly what I hear way too often from my patients. They've tried traditional standard approaches, but they're still not getting their pain resolved. So if you or a loved one suffer with persistent pain, stay with me because I have several experts who share alternative pain relief strategies that really work. Now, Debora is the founder and director of the Myofascial Healing Institute. But before she became an internationally known energy healer and pain relief specialist, she faced her own health crisis, experienced physical, mental, and emotional pain. Please welcome Debora Wayne. Debora, thank you for joining us. I appreciate it.
Thank you for having me. It's
of course.
Such a pleasure to be here.
Now, I know you've been through some really horrendous experiences with pain. Tell me about that, and that you tried to find doctors that could help you, but really you were unsuccessful, right? Tell me about that experience.
Well, for years I had mysterious pain and would go to practitioners and nothing would show up on medical tests, or they would find something and then the remedies didn't work, but my hair was falling out, I had ulcers, I couldn't sleep at night. I had to drink myself to sleep every single night for years. I just had physical pain. My mind never shut up. It was just non-stop negative chatter, and I would flip from anxiety to depression, back and forth. And this became a way of life, and I was trying to pretend it wasn't happening or it would just go away, and it didn't just go away.
It was frustrating, right? I mean, so many of us, and I know people who are watching, they're so frustrated because you go from doctor to doctor and they say everything looks good. All the tests are negative, and I know that this has happened to so many of you. But you did something very unique, which is you took your experience and you actually became a champion for other people in which you helped other people become pain-free. Tell me how you do that, because I really admire folks who don't let the situation take them over and basically took over their lives. Tell me what happened and how you were able to do that.
Truthfully, I felt like it did take me over. And I woke up one Monday morning and I couldn't get dressed and I couldn't go to work and I couldn't stop crying. And I was literally lying on the floor of my big, beautiful walk-in closet. And for the first time, I was out of my own great ideas, and I reached out for professional help. And it was we started exploring unusual paths to this pain. We started looking at the mind and my beliefs, my thinking, and emotions that I didn't even know that I had. And started talking about energy, which was something I had no idea about. And those were the 3 keys that helped me turn around my entire life and get it back on track. Because all the routes that I had taken, they just weren't working.
Yeah, and when people were exploring, you remember when she was having this pain, people didn't talk about any of these.
Oh my God.
Because in traditional medicine, you're trained to find, is an organ responsible, something broken, something inflamed, is there a tumor? You never talk about some of these key ideas. And you talked about 3 key ideas, right?
Yes.
The first one is about false beliefs. Tell us about that. How does that play a role?
So we are thinking creatures, thinking 50 to 60,000 thoughts per day.
Wow.
And these beliefs date back to childhood, these ideas that we carry around. And most of the foundation of what we believe to be true in the world and about our health and our body and everything starts before the age of 8 or 9. And this is before the brain has the ability to discern what is true from what is false.
Interesting.
Let me give you a little story here to illustrate. So I was working with an 8-year-old little girl who had just come out of surgery for cancer. Successful surgery, but out of nowhere, this extraordinary shoulder pain appeared. Nothing showed up on a medical test, same story, right? They did not know how to help her. She was in pain 24/7, 8 years old. So they brought me in to work with her, and within 15 minutes of having a conversation and working energetically with her, she starts to tell me a story about how she heard her mother and father screaming, yelling, and fighting, and that they were talking about getting a divorce. And she believed that she was the cause. She literally believed that she caused the fighting and the divorce, and she was shouldering the responsibility and had embodied the pain. So we brought the parents in, we had a conversation. This little girl became pain-free in an hour and never to return.
Wow, that's amazing. When we come back, we'll have more with Debora Wayne, and she'll talk about the other 2 keys to living a pain-free life. Please don't go away. Stay with us.
So I've developed the ability very rapidly to scan a person's field, whether they're in person or at a distance, and I can feel, literally feel, vibrations where there's disturbances in the field. And I bring in a harmonious vibration that changes the field's vibration, which communicates with the body and shows up in the physical, mental, and emotional state.
Welcome back. You're watching the Dr. Nandi Show. And today we're discussing non-invasive pain relief techniques and methods. And we're looking beyond the standard approaches to help you or your loved one live more comfortable lives. Just before the break, we're talking with Debora. And Debora, how about emotions, and how can they be connected to your pain?
Emotions are a key for relieving pain. So again, I'll give you an example. Jane had such severe digestive pain from everything she ate, and she was throwing up nonstop for 9 months, if you can imagine this. Nothing showed up on medical tests. She had to stop working, stop traveling, stop going to the gym, confined to the house. Within a half an hour of speaking with her and working energetically also, she discovered so much painful emotions, hurt, resentment, fear, anger, that was stuffed and buried inside of her. She had no idea that emotions were even going on. After our session, just one session, she has never had an episode of the vomiting. She went back to eating everything traveling, got her life back, completely back.
It's amazing. And the one thing I'll tell you is that so many of my patients and so many people assume that because the tests are negative, that the pain is not real, that the nausea and vomiting. What I'll tell you is that our technology hasn't kept up with it yet, but the pain is absolutely real, and the emotions manifesting as physical symptoms are real. And your third key, what's your third key for this pain relief?
This is the most exciting 21st century tool. It's the biofield. So it's a real field classified in physics, and what they discovered is around every living thing, including our body, is a field of energy and information, and it's informing the body, having a conversation, a communication with the physical body. But the key to health, and especially pain relief, is that it starts in the field first before it shows up in the body. So we can work at an energetic level. It's the most rapid way to release pain, suffering of all types.
And it's amazing, you know, I said in multiple shows before that the key to future medicine is going to be in energy medicine. And to help you understand how Debora interacts with this energy field, here's a short video showing her in the healing mode. Please take a look.
12 years ago, I was diagnosed by an MD with fibromyalgia, chronic fatigue.
I'm actually going to be able to scan your field and feel disturbed information. Just as if I'm touching something, I feel a change in what I call the energy.
I started feeling a very nice warmth. It was so unexpected, all the things that happened.
I can feel it moving through my body, out my hands, and communicating with her field.
The amount of healing that I had is unbelievable, and it was instantaneous. With fibro, you have pain in a number of different places, and that was just gone. I have 2 cataracts in that particular eye. I can read with it now. I've had insomnia for 12 years. I can't wait to go to bed now at night because I can sleep again. I couldn't even bend over and pick up something off of the floor. I walked into a physical therapist, and she said, you know what, your spine's almost perfectly realigned. I have had major improvements. She was given a gift to be able to help people.
So tell us, you know, what were you doing and how this all works?
So I've developed the ability very rapidly to scan a person's field, whether they're in person or at a distance, and I can feel, literally feel, vibrations where there's disturbances in the field. And I bring in a harmonious vibration that changes the field's vibration, which communicates with the body and shows up in the physical, mental, and emotional state.
That's amazing. And you could see in the video how the person gets better. And do you use it in all your clients, or do you use it in some of the clients? How do you decide?
I love a combination of working in the biofield and exploring the false beliefs and finding ways to release the emotions that are buried. And if you cover all 3, you will find the root of pain and disease. I
want to show you this book that Debora's written. It says, Why Do I Still Hurt? Rapid Relief for Chronic Pain, Depression, Anxiety, and more. And if you'd like to learn more about biofield healing, Debora is the #1 best-selling author of this book. And I'll tell you, it's worked wonders for so many people. Right now, we're going to take a break. When we come back, you'll meet Emily, who suffered from years of chronic pain after a serious car accident. Please stay with us.
What I discovered is that our bodies really are meant to be self-healing. We just need to know the right ways to move them in order to help facilitate that.
Welcome back. You're watching the Dr. Nandi Show, and today's show is called Please Make My Pain Go Away. And right now, an estimated $600 billion, that's right, $600 billion, is spent on pain treatment every year in the United States alone. That represents a lot of people needing help. And a National Institute of Health study in 2015 found that an estimated 25.3 million adults had pain every day for 3 months. It's amazing. Now, there are 2 major types of pain. We're all familiar with acute pain. It's instant. It happens when you hurt yourself or have surgery or an illness, right? But that pain is normal and can be short-term. Chronic pain is pain that's long-lasting. It's persistent. back pain, neck pain, joint pain, nerve damage pain, and headaches. These are just some of the more common forms of pain that my patients suffer with every day. Maybe you had an injury that healed, but the pain stayed, or maybe there appears to be no reason at all for it. My next guest is all too familiar with chronic pain. She survived a severe car accident that dislocated both of her knees. At one point, she spent a whole year lying down with ice packs on her back. Told by doctors she needed surgery, she decided to give different approaches and fix herself instead. She's now been pain-free for an entire decade. Please welcome fitness and wellness coach, our friend Emily Lark. Emily, thank you for joining us.
Thank you so much for having me. Thank you.
Well, of course. I'm excited to hear what you have to say, and tell me about your journey in this chronic pain and what you did to defeat it.
Yeah, absolutely. Well, as you said, when I was 12 years old, I survived a near fatal car accident that left me with years of chronic pain well into my teens and my 20s. During that time, I tried every kind of treatment I could find to try to fix my back pain. Chiropractic, acupuncture, massage therapy, and I would get temporary relief, but the pain always seemed to come back. And then finally, when I was 28, I was unable to work full time. I spent a year lying on ice packs. I spiraled into a deep depression because, as anyone with chronic pain knows, it doesn't just hurt your body, it hurts your whole life.
Correct.
And that's when I was told I needed back surgery.
And so what'd you do when they said that?
Well, at first I was pretty mad because I thought, I'm 28 years old. I can't be going into back surgery.
And laid up for months, right?
Absolutely. So that's when something in my brain kind of clicked, and I thought, there's got to be a better way. There's got to be something. So I spent a year of my life researching the human body and using my own body really as a test lab, kind of solving the problem of my own pain. And what I discovered is that our bodies really are meant to be self-healing. We just need to know the right ways to move them in order to help facilitate that. And that's what I was able to do. And I have been pain-free ever since.
That's awesome. What a story. So, for those of you who are suffering, like she was, there's hope. And we hear about yoga. Did yoga play a role in the self-healing process?
Absolutely. And I am a yoga teacher, and yoga plays a big part in that for sure. It's wonderful for releasing tense, tight muscles and maintaining the mobility in our spine, which is very important. However, I have found that when it comes to long-term back pain relief, yoga by itself is not quite complete. It treats the symptoms and helps stretch out the tight muscles, but it doesn't really help address the cause, which quite often is frankly muscle weakness that contributes to back pain, a weak core, weak hips. So combining yoga with strength work, especially core strength work, to me has been the powerhouse that can help give that long-term back pain relief.
That's huge, and I'm glad you said that. And if you heard what she said very carefully, yoga helps the symptoms but doesn't go to the root cause. So you need more than that, and that's very important. We have a question from social media, I'm told. Rob from Arizona asks, I sit a lot for work. Welcome to the club, Rob. And my back gets sore. What can I do at my desk to help with the pain? This is really key because so many of our viewers have this problem. What can he do?
I love that question because really it's my belief that sitting too long is one of the biggest culprits that causes back pain. So I'm going to show you one stretch that he can actually do in his chair at work. People call this my secret stretch because it helps with low back pain.
Not anymore.
Yeah, I know. It's out there, guys. It's out there. It's about to be.
That's right.
So this stretch can help with low back pain. It can also stop sciatica without injections or surgeries.
Okay.
So super simple. Are you gonna do this with me?
I'm gonna do it. Yeah,
I love it. I love it.
Absolutely.
Okay. So what we're gonna do is we're gonna take one ankle and we're gonna cross it over the other knee. Yeah.
Okay.
Now, if you can't get your ankle over your knee, you can also cross it over your other ankle. You can straighten your leg and then slide it up and pull it up. You want to flex that top foot. That'll help protect your knee joint. And then you're going to gently press down on this knee toward the floor. You might start to feel a stretch in your hip.
Yeah.
If you want to intensify that, you're going to lean forward a little bit. Now what we're doing is we're targeting the piriformis muscle. When that muscle is tight, it can aggravate the sciatic nerve. So what he'd want to do is sit and hold this stretch for 30 seconds on one leg and then do the other leg as well. Even if you just have pain on one side, always do both sides.
And how often should you do that?
Oh my gosh. Well, there have been times when I've done it several times a day. I like to tell people to try to do it at least 3 times a day. You can remember when you sit down for breakfast, lunch, and dinner.
It's time to take a break. Up next, you're going to meet an enthusiastic advocate of quantum neurology. So what's quantum neurology, you ask? Well, stay tuned and we will tell you.
and we use an instrument called the Arthur stem, beats at 12 to 14 beats a second, and we put the force into specific points on the body, and then the body creates neurological recognition, and it heals from
It looks a little scary though, Dr. Rump.
It does, and it shouldn't be intimidating.
It's not though.
No,
Okay,
no,
good.
it doesn't hurt.
Welcome back here. Welcome to Dr. Nandi Show. And today we've been talking about pain and the alternative ways to find relief. My next expert is passionate about helping people understand that their bodies are capable of healing themselves when the nervous system is connected. Now, the nervous system is a complex network of nerve cells and fibers that send signals throughout the bodies. Dr. Tony Rump compares the nervous system to circuitry in our house. And when you blow a fuse, you have a problem, right? So here to explain how this relates to pain is quantum neurologist, certified practitioner, Dr. Rump. Thank you so much for joining us. I appreciate it. This is pretty cool. So tell us how the nervous system is like circuitry in our house. This is a good way for people to understand it.
Yes, very good way. The two parallel each other so well. So like if you are plugging in roasters at Christmas time, you blow a circuit breaker.
Yeah.
That circuit breaker is there to protect the house from burning, from injury, that type of thing, to protect itself. In our body, through injuries, illnesses, conditions, we can overpower our nervous system. And when we overpower our nervous system, it's designed to protect ourselves. So it shows up as pain or chronic pain. And so by reconnecting the nervous system, then the body does what it does, and that's default to health.
It's almost protective, and people view pain, and because we hate pain, of course, but you view it as a bad thing. And traditionally, it can be if it's debilitating, but the thing is, it's actually your own body's way of telling you something is actually not working correctly. Now, your daughter had some sports injuries that you're able to use this quantum neurology. Tell me about that.
Oh, that was a highly tough time for our family. My daughter was an up-and-comer basketball player, and she was trying to make the team, and she was being really aggressive, and she was really a lot of fun to watch. She was being very competent and very skillful in it all. Yeah, there she is.
She's cool.
Yeah, I'm gonna be in trouble for that one. But she, just on a Saturday afternoon, she twisted on her left knee and she tore her knee. Well, I was a practicing chiropractor physician for many years, and I know the limitations. There was nothing I was going to be able to help her. So that's how I got introduced into quantum neurology. Well, that injury, she really struggled with. I mean, it was painful for us as a family because she had 6 months of physical therapy visits, orthopedic visits. Her grades plummeted. She really struggled with all that.
It affected her whole life, didn't it?
Yes. So after that 6-month ordeal, she was released, and things were good. We thought we were through the woods. 6 months later, same calendar year, she tore her right one.
Oh, geez.
Yeah, it kind of really stunk. And it was a kick in the gut. But at that time, I had learned enough of this nervous system rehabilitative technique that I started applying the principles to her immediately. And she got off the trainer's table within 5 minutes, no pain, full range of motion. And I thought for sure.
5 minutes?
Yeah, I thought I had my tools. I mean, it was there.
But you've got these tools, right? So maybe you can tell us what you're doing here with this stuff and what it's all about, and it helps us maybe understand it better.
Well, in using quantum neurology, when we find a weakness in the nerves, we use the muscle testing. And once we find a weakness in the nerves, then we use an instrument called the Arthur stem, beats at 12 to 14 beats a second, and we put the force into specific points on the body, and then the body creates neurological recognition, and it heals from
within. It looks a little scary though, Dr. Rump.
It does, and it shouldn't be intimidating.
It's not though.
No,
Okay,
no, it doesn't hurt, and it's very, very effective. And then we use light therapy also. I use a GRT light. It's an LED light.
Yeah.
And found out through clinical research that it actually makes these corrections last longer and more effective if we have light on them. So that's how we perform the corrections.
And here's the thing, and so the key is that when you have techniques, we always when we have this kind of pain, we're always going to traditional doctors and they can't really help you. And you got techniques like quantum neurology. I want you to, we'll put up the website, I want you to look this technique up and see if this could be helpful for you. Dr. Rump will be accepting new patients. We have to take a break. When we come back, my next guest was in a rollover car accident so severe she was almost strangled by the seatbelt. She spent 2 weeks in a coma and woke up in a full body brace. Her journey with pain and healing is coming right up, so please don't go away.
I had so much pain that I just needed someone to put their hands on me and acknowledge the pain. And in my neuro rehab, there was an occupational therapist and he had done the training. And I said, wow, I need to learn this. And it's a sustained, steady pressure on the body, and it helps organize the nervous system to go to the area, and then the muscles start to unravel.
Welcome back, and thank you for watching the Dr. Nandi Show. You've heard from several of my guests who've suffered terribly with pain. Their determination to find root causes and solutions not only led to them healing themselves, but they're using the experience to heal others as well. Now, that's exactly what my next guest is doing. Phaedra Antioco was a pediatric therapist on her way home from work when she had a rollover car accident. A passing truck driver stopped and cut loose the seatbelt that was strangling her. She woke up in the hospital in a full body brace on a ventilator with multiple injuries, including a serious brain injury. Now, she's a therapist who became the patient. Please welcome Phaedra Antioco. Phaedra, thank you for joining us. What an amazing story. You are a miracle.
Thanks for having me.
Of course. Of course. Tell me what happened and your journey. You know, I mean, what changed your life, you know, with having this?
Well, it was just a perfect day driving home from work.
Yeah.
And I woke up from a coma, and wow, my world changed. And yes, I had physical pain, but the trauma of just what I'd learned, what happened to me, it was overwhelming. And I heard I had a brain injury, and I'm like, I treat brain injury, I'm not supposed to get one.
Right.
And I did everything I could to overcome it.
And what was life like? So, you're driving home from work like every other day, and then you have this horrible event. What was life like then?
It was challenging. I was in shock. I was in pain and did whatever I could to keep moving forward. And I was alone, and I had to reach out for support. The community raised money for me.
Wow.
Family came, and they were able to be there for me and get me through it.
And what are the symptoms you were having? Like, what kinds of things were happening to your body that had never happened before?
Well, I had a severe brain injury,
Yeah.
so I couldn't think straight. I was funny with my words. I had a near spinal cord injury, so I had numbness. I couldn't get up. I had to roll to the side to put the full body brace on. And my leg bones, it was an open fracture, so they came out of my legs. And to this day, I still have a broken fibula in my lower leg, but I've found some great solutions for it.
That's amazing. And tell me your journey and how you found those solutions. I know your family came and the community did, but what did you do? What's amazing to me is amazing people like yourselves, in that so many people have tragedies, but what they do, for those of you who are listening, is that they let that overcome their lives. And what you did was you took that and you said, how am I going to make solutions? I'm not going to let this beat me. Tell me, first of all, why you did that, and also how you overcome and how you found your solutions.
I think it was my strategy. I mean, it really, in some ways, it was a gift that it happened.
Wow.
It was just a gift, and it was not something that just, it was, I think it was planned in some way. And I said, I'm going to use this for the better. And it was an intense injury. You look at those pictures, they're really intense.
Yeah.
So I said, I need to find a way to help people, and a lot of it is the determination. And there was this inner fire in me.
And tell me about this myofascial release, because that's a tremendous technique. Tell me about this, and did it help you, and who it can help?
It can help anyone. It really helped me. I had so much pain that I just needed someone to put their hands on me and acknowledge the pain. And in my neuro rehab, there was an occupational therapist, and he had done the training. And I said, wow, I need to learn this. And it's a sustained, steady pressure on the body, and it helps organize the nervous system to go to the area, and then the muscles start to unravel. So a regular massage, they go on, off, on, off.
Yes.
It stimulates the nervous system.
Yeah.
We go right there. We meet the barrier of the fat fascia, and it just starts to unravel. So sometimes though we check out, we leave our body in the muscle, we can feel that in there. So we use dialoguing and guide the person to feel into their body part, and in my case it was the leg.
So it's physical as well as spirituality.
Spiritual and mental, because when we are in pain, when I was being strangled by the seatbelt, which I still kind of feel in my body, the body remembers it, the nervous system goes into fight, flight, or freeze.
Yeah, in my
And so-
notes, you've said that. You said, you know, that you felt like your body remembered being strangled even though your mind did not remember. What does that mean?
Well, when I had the myofascial release treatment, the release they gave in my diaphragm, it brought out the fear of a high speed, you know, wow. And that's what happened. So
But
I said,
your body
I need to know
remembered
that.
that.
My body remembered.
Even though your mind had forgotten
Yep.
about it because of the brain injury. That's fascinating. And so once that myofascial release helped your body then stop remembering and then giving the pain as a response. That's amazing. So for those who are watching, and if you're following with us, it's the fact that her body actually felt that seatbelt and felt that whole impact, and your body has a memory. That's amazing. The condition that she's treating and the treatment is actually called myofascial release. And tell me how people can go to your website and find out more about you and this technique to see if it's right for them.
Sure, I have the paintreatmentsthatwork.com, and I have a breaking
The
paintreatmentsthatwork.com.
You're so amazing. Tell me more about that. And so,
Well, I want to find out, why do some people get better and others don't? And people are tired of spending money on treatments that work. So I do my research and find out what works for people and put that together there for them. And I have the Breaking Free of Pain program that's been really effective, helping thousands of people.
and so when you're listening to Phaedra, you have to know that you have to be able to be willing to accept this and accept the fact that there's more to your pain than just the physical symptoms. And I hope that her story has inspired you just as much as it's obviously inspired me. It was a devastating accident that she turned into a gift for herself and others. And we're about to take a break. Up next is my final expert, a good friend of ours, a medical doctor who has treated patients who felt that there was absolutely no hope of feeling normal and healthy again. We'll be right back. Please stay with us.
Our study is actually the first large-scale study to show that one psychological intervention for chronic pain is actually superior to any other.
Welcome back. You're watching the Dr. Nandi Show, and today's show is called Please Make My Pain Go Away. Now, short-term pain, for the most part, is fine, as it's your body's way of letting you know that something's happening, right? But chronic, long-lasting pain can negatively affect your life in so many ways, making you feel miserable, depressed, anxious, unable to work or accomplish typical tasks. At times, you may think it's all in your head, that you have a mental condition, right? And that's exactly what my next expert is going to address. He's a medical doctor, a friend of ours in the show, and the director of the Mind-Body Medicine program at the Providence Park Hospital. And here to talk about brain-generated pain is Dr. Howard Schubiner. Dr. Schubiner, thank you for joining
Good to
us.
see you again.
Oh, we appreciate it. Yeah, thank you. So two types of pain. Tell us about that. There's two types of chronic pain, right?
Well, you're asking the right question, because as a doctor, you know, if you get the wrong diagnosis, you get the wrong treatment.
Correct.
And most people don't really understand pain. Most doctors don't really.
Right. Absolutely.
Pain is actually generated by the brain, by what we call the danger alarm mechanism. And obviously an injury can trigger that. But the brain can generate pain in the absence of any tissue damage. And I've had this. I've had neck pain due to my brain and stress. I've had back pain. You remember being an intern? When I was an intern, I had 6 months of diarrhea.
Wow.
And, you know, to be frank, being a doctor scared the crap out of me. So
what's this brain-generated pain? Is it rare?
when you think about the causes of chronic pain, headache. Millions of people with migraine and tension headache. Neurologists all agree, very small percentage of those people have structural disease in their brain, in their head. Fibromyalgia, experts agree, no damage in the body, but very real pain. Irritable bowel syndrome, no damage in the gut by definition, as you know. Mm-hmm. And then when you get to back and neck pain, it's surprising, But studies show that about 85% of the people with chronic neck and back pain don't have a serious, clearly identifiable structural cause for their pain. And that's shocking.
That's unbelievable. And people, when they have this brain-generated pain, how can they heal from it? How can they treat this type of pain?
Well, the first thing is making an accurate diagnosis. The vast majority of adults have abnormal MRIs of their neck and back who
Right.
have no pain. And so when you think an MRI is going to show you the cause of your pain and you have mild changes that everybody else has, when you think that that's the cause of the pain, that generates more fear. So this danger alarm mechanism in the brain is triggered by fear. The more fear, the more pain. The more pain, the more fear. And that's the vicious cycle that chronic pain is for most people.
Yeah, and that danger alarm mechanism is a bit like your fight or flight mechanism, is it not?
Exactly.
I mean, your body's giving you like danger, danger, something's happening. We actually have a question, they tell me, from a viewer from Toronto, and it says that I've had pain in my neck, but the MRI shows no physical injury. I'm confused. If I'm in pain, shouldn't it show damage? This is so common, right? Because people get these MRIs, CT scans, all negative. They go, what the heck's going on? Where is the damage?
Exactly.
Now, what do you tell patients when they come and tell you that?
Exactly. What we're doing is making an accurate diagnosis. And I spend a lot of time with people listening to their story in detail. When the pain starts in one area and it's spreading to all these other areas, chances are the brain is causing that. When the pain is on one side of the back and then the next day it's on the other side of the back, chances are that's not a structural disorder. And so people who have this kind of situation, plus they have other stresses in their life, history of anxiety, history of other things in their life such as headaches or irritable bowel, etc. When you put it all together, then you can make an accurate diagnosis. A lot of people have abnormal MRIs who have no pain. A lot of people have normal MRIs of
With
their back
pain.
with pain. So our job is to make an accurate diagnosis, to figure it out. Once you figure it out, then you can start the treatment, which starts with educating the patient, and then it's unraveling this relationship that people have with their pain. It's changing how they see it, how they react to it, how they move with it, how they think about it. And all those things are very powerful to actually turn off the danger alarm mechanism, which turns off the pain.
Absolutely. And so, Nicole, what I would say is that this is very common, and you have to see your doctor, and also maybe you can see Dr. Schubiner, and look at ideas and symptomatology, like you talked about. Look at ways you can find out whether it's structural or something that's going through perhaps a brain-induced mechanism. And something that he said was very important is your relationship with the pain is so important. Your response to the pain is so important. So it goes back here. It's talking about the mindset. If you don't change the mindset, you're never going to be able to what? Make the pain go away. And you know, I know you took part in some research, NIH-funded research trial that talked about emotion-focused therapy and its effect on pain reduction. Tell us about that.
Our study is actually the first large-scale study to show that one psychological intervention for chronic pain is actually superior to any other. And the model we tested was compared to cognitive behavioral therapy, the standard pain psychology treatment. And our model takes into account emotions. It's helping people access emotions like anger, guilt, sadness, and compassion that they often have avoided in their life. So the connection between emotions and pain is very powerful. fMRI studies show that when you give someone a physical injury and you scan their brain, and then you give them an emotional insult or injury and scan their brain, the exact same parts of the brain light up. And that's how we're designed.
That's awesome. Dr. Schubiner is amazing. And if you'd like to learn more, Dr. Schubiner has written several books. One of them is called Unlearn Your Pain. And I got it right here, a 28-day process to reprogram your mind. It's now time for another break, but please don't go away. We'll be back with my prescriptions for your pain relief. Please stay with us. Welcome back. You're watching the Dr. Nandi Show, and today I gathered experts who have personally been affected by pain because as a physician, I know too well how many of you need pain relief. So I hope today's show has given you some fresh ideas of how to tackle your pain and live a more fulfilled life. So what can we take away from today's Partha's prescriptions? First of all, many beliefs are formed in early childhood without us even realizing it. It's important to identify and clear the false and limiting beliefs as they can create emotional reactions which can contribute to pain-related conditions. Also, yoga, I love it. It's great in reducing chronic lower back pain. You may also need to combine it with core stability exercises to help to relieve pain. Also, don't stop living life because of pain, or you could risk getting worse. So get moving, even if it's walking to the mailbox or dancing in your living room. And finally, your chronic pain may be caused by neural pathway pain. Emotional-based therapy may help you recognize, express, and process powerful emotions, and this could reduce your pain significantly. To stay informed about today's topic about pain relief, learn about healthy living, and how to become your own health hero, please visit me at AskDrNandi.com. Also, we'd love to hear from you. Be sure to search Partha Nandi MD on Facebook, Twitter, and Pinterest, and join the discussion. Lastly, there's a beautiful word in the Hindi language that literally means the light in me honors the light in you, and that word is namaste. So namaste to each and every one of you. Thank you for watching, and I will see you next time.